Hi everyone, I'm Howard, and this is Otto's Retirement Corner. Okay, today I want to continue our discussion of Medicare for all or single payer government sponsored healthcare for the entire country. We talked about it a little bit in the last two videos. Today I want to talk about some of the issues with it, some of the problems, some of the hurdles, and some of the difficulties with trying to do something like this. So, we talked slightly about switching costs. We talked about where the money comes from for healthcare now, all the people and entities and groups that pay for it. And now we switch to a income tax, basically, to cover all these expenses rather than all the different places they're coming from. And when we say income tax, we're talking about exactly that. Just how you pay income tax now, there would be a higher income tax or a separate income tax to cover Medicare for all. Now, depending upon whose estimate you look at, and I've done mine, I did a white paper on this for my company many years ago. The numbers have completely changed, obviously. Healthcare expenses are about 40% higher now than they were when I last did this. So depending upon who you want to believe, I'm going to use a number of, you would have to increase income taxes by 150%. Okay, so right now the government takes in about 2.7 trillion in income taxes, and I'm saying they would need to take in another 4 trillion. It's probably less than that, but I'm being conservative, and it doesn't really matter for purposes of this discussion because we're not going to draw up a plan for this. It just shows you some of the issues and hurdles and difficulties you have with putting something like this together. And I know people are shocked, hey, I'm not paying more income taxes. But again, remember, this replaces the premiums you pay for your health care insurance. It replaces your copays. It replaces your deductibles. If you're still working, it replaces your FICA tax for Medicare, the 1.45% or 2.35% if you're a high earner. So a lot of expenses go away. And some of the conversations I've had online with people is, okay, you're spending $4,000, $5,000, $6,000, $7,000, $8,000 now. And if we increase your income taxes by $6,000 and it's less than you're already spending, isn't that better? Oh, okay, I guess that's better. But that's the kind of thing we're looking at. So when you say increase by 150%, take a married couple that pays $20,000 in income taxes now, you're talking about $50,000 in income tax. So that's a $30,000 increase, and possibly, if it's a family, equal to more or less than they're spending now. So it's very tricky because anytime you say to somebody, we're going to raise your income taxes and it's going to be more than you're currently paying for health care, they lose, all right? And for this plan to work, there's going to be losers and there's going to be winners. And if it's a progressive tax, the losers are the high earners. The losers will probably be corporations. And when you say corporations pay higher taxes, that'd be in lieu of the amount they pay for their employer's health care insurance. So it'll offset some, but it will be higher. All right. Will they raise prices in response to that? Possibly, probably, maybe. Depends on what companies and how much. And that cost will be shared by the entire population to a much, much lower extent. So let's not dwell on that right now. There are solutions. There's about I could probably come up with 100 different ways you can dice that up, and there will be pain points for some, but the idea is to make the low earners, the poorer people, pay less than they're paying now. So, take somebody who's retired, and the only income they have is Social Security. Maybe they're making $20,000, $24,000 a year in Social Security. They're living very meagerly, but they have Medicare. So they're paying their $175 a month, and they're paying for all their care, or they have an Advantage plan, whatever coverage they have, and they may be spending $4,000 to $5,000 a year. That's Otter's objection. We'll play later. Okay, so they may be spending $4,000 to $5,000 a year on health care, even though they only are bringing in $24,000 in income total. And maybe they have some savings to buttress that. So if you said, okay, now these people who don't pay any income tax now will now pay $2,000 or $3,000 a year in income tax, keep in mind that that will replace the amount of money they're already spending for their health care costs. So while it's much more in income tax, it may be lower overall spending. So in return, they get, in essence, once they pay those taxes, free health care. And when I say free health care, yes, I know income taxes are paying for it, but at the point of service, you're not paying anything. All right, so who else loses? Who else loses in this? And there's a lot of losers, and there's probably a lot of unintended consequences that would happen down the line. But I'm just going to touch on a couple obvious ones. Tell me in the comments the ones I didn't mention, and I'm probably aware of them, but I don't have all day, and you don't want to hear from me all day. So the first big losers are the health insurance companies. These don't necessarily go away. They just won't be selling healthcare insurance to most of their customers anymore because people will get it, in essence, for free after they pay their taxes. So, what does that mean? Will people still buy private health insurance? And the comment I get a lot often is, well, the wealthy people will still do that. Well, keep in mind, the wealthy people will probably be seeing their income taxes double, triple, or greater. So once they do that, do they want to pay a separate amount to an insurance company who may or may not cover everything they're going to get done? I doubt it. So my guess is health insurance companies disappear. And what does that mean? The IBIS world, who does statistics on all sorts of things throughout the country and world, their estimate is there's 560,000 people working in the health insurance industry in the U.S. So 560,000 people immediately lose those jobs with those insurance companies. Keep in mind, though, that these people are good at processing claims and talking to people on the phone in customer service, and the government will need many, many, many more workers if they're going to tackle this. So a portion of those people will be absorbed. So let's say, we end up with a net 300,000 people unemployed. That's terrible. That's awful. If you're one of them, it's the worst thing in the world. I understand that. But in the overall scheme of things, when you're looking at 250,000 people a week losing their jobs in a normal low layoff environment like we're seeing now, that's a number easily absorbed by the economy. And again, it's not lost on me that people lose their jobs. I get that, but this is the price that would have to be paid. Then you have your pharmaceutical companies. Part of this plan is that reimbursement rates for drugs would be lower. They would match typically what Medicare pays. They would also have the power to now negotiate lower prices on a lot of these prescriptions. And lower prescription prices obviously mean lower selling prices for the pharmaceutical companies, lower revenues and lower profits, and that could lead to some layoffs. On the other hand, volume would probably go up because more people are getting health care and buying drugs. So they would have to operate in a lower margin environment. And one of the consequences of that may be reduced research and development by the drug companies because there's not as much incentive to spend a lot of money to develop drugs if they're not going to get great reimbursement rates. Although we've seen, $50,000, $60,000 a month for drugs for Medicare now. So I'm not saying that's not going to happen. It's just that's a possible ramification of this new drug policy. So, the other obvious one is physicians and employees, private practices. They're going to have lower reimbursement rates. And, it's really hard to survive on Medicaid rates. Medicare rates are difficult, but you can survive. Without commercial pay, it's going to be tough. All right, so physicians would have to make less money. We covered this a few videos ago where, that's one of the drivers of the high cost of healthcare. Physicians make a lot of money. Now they would have to make a little less money. And obviously they're going to pass on some of those losses to their employees. So employees will make less money, and maybe there's lower employment. But then on the flip side again, they're going to have much larger volumes. Many more people are going to doctors. Once everyone knows they can go to a doctor whenever they want and not have to pay anything, they're going to flood the doctors. So can they make some of that up with volume? Some, yes, that will happen. And hospitals, that's another clear one. Hospitals would have a really hard time surviving on just Medicare reimbursement rates. Even the really rich not-for-profit hospitals we've talked about before. So, Medicare reimbursement rates would maybe have to be adjusted, not quite where they are now, but certainly lower than commercial rates. And again, that would affect staffing, but again, volumes would be a lot higher. So, all in all, we talk about higher volumes, and in my mind, it's one reason why you cannot, this system would not survive without copays. And, the idea is not to do copays, that you just go and you get free health care. But once you tell 330 million people you can go to the hospital or a doctor or whoever you want, whatever specialist, whenever you want, as many times you want, and it costs you nothing, they will do that. When you get a headache, you'll go. When you have a fever, you'll go. Where right now you might not go because you think, I don't want to spend the 50 or 100 or 200, I don't want to go to the emergency room. It costs me hundreds of dollars. If it's free, you're going to go far more often. So there's got to be a copay system. And even at the lowest level, whether it's $10 or $20 to see a physician or $100 to go to the hospital, there has to be a copay system. Otherwise, like we've seen in Canada, they get flooded and you wait months for an appointment or for imaging or whatever it is. There's got to be a way to temper the number of people who are going to go immediately for health care. So, all in all, the implementation will be difficult. To make this happen, you can't just snap your fingers and say, okay, January 1st, we're on this new system. There would probably have to be steps taken where you move slowly onto the system, you slowly lower reimbursements, you let the industries adjust to it. It may take 2 or 3 years. Is it possible? Yeah, it's possible. Will it ever happen? I'm dubious. I'm not really confident it will happen. I think it would help if it happened. But, tell me what you think. And that's what this is all about. Let's discuss this. Give me your comments, pros and cons. Again, I haven't extensively covered this whole topic. I'm 12 minutes in here, and, there's 100 other things I can talk about. I know that. Feel free to bring them up. I'm not ignoring them. I'm not avoiding them. I didn't forget them. Certainly some I probably didn't think of. So give me your comments. Tell me what you think. Subscribe, please. Like, share. Comment. Thanks, and we'll see you again next time. Bye.